I'm Xiomara Nunez, and I'm sitting here with Sean Webb to talk about his Scholars in Rural Health Program admission. So Sean, why don't you tell us a little more about the program?
The program is for students from small towns in Kansas who want to go back into rural communities that are underserved and do primary care. There's a lot of areas in Kansas, about 95-ish of the 105 counties in Kansas are considered underserved, and a lot of that's primary care. So the program is aiming for students that want to go back into those areas and do that kind of work, and is giving them an early acceptance to medical school and kind of getting them on the fast track.
What made you want to apply to this program?
When I was in high school, I really discovered that going into rural medicine, doing primary care in a small town like where I come from, because I'm from Wamego, doing that kind of thing was what really appealed to me in medicine. I'd wanted to be a doctor for a few years, but I didn't know what exactly I wanted to do. And I really started to fall in love with the idea of being in a small town and having that sense of community with patients. When I heard about the program that has the early admission to medical school, puts members of the program on priority for state money that will pay off their medical school, those type of things, the program really appealed for me, and I really liked its mission.
So have you put any thought into where you're going to go to medical school?
The program's through the University of Kansas School of Medicine. So if I complete the program requirements by the end of my senior year here at Baker, if I complete them to their satisfaction, I'm automatically admitted to KU Med after I graduate.
What are some of the program requirements?
I have to do 40 hours of shadowing with a physician in my hometown minimum each semester. And each semester they kind of tailor it to a different side of medicine. So this semester, the members of the program, we focus on treating patients in the clinic, in taking call with doctors, lab procedures, things like that. And then next semester it focuses more on inpatient. So all 5 different segments have a different focus. So I do 40 hours of each semester and then 40 hours next summer in between my junior and senior year. So I'll have a minimum total of 200 by the time I'm done at Baker. I do a case report each semester on a patient or a situation that I turn in to our director. I do a long paper my senior year, starting this May is actually when we start turning in topics. That's a manuscript on some rural healthcare topic as it relates to our experience in shadowing. And then this spring I take the medical college admissions test, and so those are the big 4 requirements for us to do.
Do you know what field you want to focus on now?
Not for sure yet. I probably won't be until I get through medical school, but the 2 that I would really probably at this moment like to be a part of is general family medicine and then general pediatrics.
What process did you have to go through to apply for this program?
Well, it started with a 4-page application with contact information, parents' information, and then high school and college awards and activities and service that I've done, community service. And I had to write a personal statement, which was a little under a page, about my commitment to service, my commitment to rural medicine, why I wanted to be in the program, and what drew me to medicine. So I sent that in along with 5 letters of recommendation. So I got 3 from professors here at school and then 2 from back home. And then I got an email back in the middle of June, or towards the end of June actually, that said that I'd been invited back to interview. And I interviewed July 10th, so right at the beginning of July. And I did 2 30-minute interviews at the KU Medical School campus in Salina. And then actually that afternoon got the email that I'd been accepted.
So there's 15 of you selected statewide. Being one of those 15, what does that mean to you?
It's the realization of probably the biggest goal I've ever set for myself, and I've always been known as someone who sets my goals really, really high. And that's one that I've had for a long time, and it's one of the ultimate things I wanted to achieve. It was more than just an A in this class or an A in this other class or doing this well on this test. It was a lot more than that. It was getting into a program, putting myself in a position where I could achieve what I ultimately want to achieve in my life, which is to become a doctor. And so to be able to be one of those 15 selected, it's not even about being one of 15, it's just about being one. It's about being in the program and being able to follow my dream of becoming a doctor, and seeing that I can fulfill that dream and that I've been able to get into this program, which is, a hard thing to do. It's a confidence boost, and it's really a dream come true.
How do you manage all of this? Like, you're applying for this program, but then you have to focus on your studies and like involvement in school. Like, what do you do to manage?
Well, I think a lot of what I do is I take things like a little step at a time. I try not, I didn't do the application all in one day. So, just breaking that down and using your time effectively was what I really tried to do. And it worked out pretty well. It's kind of the same thing I do, with regular classes and in just trying to not get myself bogged down and not try to do everything at once, but spread it out, and it normally works pretty well.
Last interterm, you visited Cambodia. So do you think that experience in Cambodia has helped you to move forward into achieving your goals?
Cambodia was an eye-opening experience just because of the level of poverty that we dealt with. It's a level of poverty that I'm not sure is anywhere in the United States. It's really, really sad. It's heartbreaking. And it provided you some sense of kind of that warm feeling when these people would come into our clinic who didn't have any money. The shoes I was wearing probably cost more money than they had total. And it's just a completely different dynamic because they were so thankful. They had nothing. And regardless of what we could or couldn't do for them, depending on their illness, they thanked us over and over again. And, to feel like you did everything you could and you did something to help someone else who really, really needed it, there's not a lot better feeling than serving someone like that. So, I loved going to Cambodia. I'd like to maybe go back someday on the same trip, to be able to go back and visit those people again and continue to work with them, because it was a great experience for me.
You said you wanted to go back on this trip, so like the feel of like the closeness and everything, like them being thankful, is that something that you look forward to when you're a doctor in a small town?
The community sense is probably the biggest thing for me. That feeling of connection with your patients. It's not, you see your patient one time maybe and you may never see them again. You see them in the office in a small town. You see them at the grocery store. You may coach some of your patients in Little League someday. It's just a completely different feeling, and I love that because you can be an influence and you can connect with them outside of when they're sick or, when you're checking their height and weight. It goes farther than that. And, Cambodia was about treating people and giving people medical attention when they didn't have access to it. But it was also about being a positive example and a role model and, making a difference. And that kind of thing, I think, parallels between the two. And that's really, I think, my goal in medicine, is to be a doctor that connects with patients, who serves patients, and who really makes an effort to be that positive influence in their lives.
Sounds like you have your hands full.
Yeah, a little bit.
Well, thank you, Sean. Thanks for sitting in with us as we talked to Sean Webb about his Scholars in Rural Health program. I'm Xiomara Nunez reporting for KMBU TV.